Finally, time now for our Saturday health segment. We call it Doctors on Call. Today we're talking about swine flu, what causes it, the symptoms, and what you can do to protect yourself from it.
Hello and welcome to your new health segment, Doctors on Call. In this segment, we will discuss common health issues, myths, and newer advances in healthcare, all backed by scientific data. I'm your host, Dr. Samir Gupta, a cardiologist.
And I'm your co-host, Dr. Sonia Lal Gupta, a neurologist. Samir, do you know that an average person touches their face a few hundred times a day?
Really? A few hundred times a day? That's really scary. We are now in January, and as the temperature drops all over the country, it also marks the peak of the swine flu season. Last year alone, there were more than 12,000 documented cases of swine flu, with almost 800 deaths.
Since the flu season is peaking again, it is important to know what is the flu, what is swine flu, and what are ways to prevent it. Seasonal influenza, or the flu as we call it, is a viral infection caused by the influenza virus. This infection infects your nose, throat and lungs. H1N1 or the swine flu is a type of influenza A virus. It was called the swine flu because it was first seen affecting pigs. When someone coughs or sneezes, the flu virus travels through the air in the form of small particles. You can inhale these particles directly, or you can pick them up from objects where it can stay for up to 24 hours. These could be the telephone, computer keyboard, tables and even the door handles. It can then be transferred to your eyes, nose and mouth where it enters your body. Once it enters the body, it multiplies, spreading through the bloodstream, making you sick.
Once you catch the flu, you carry the virus for 7 to 10 days. During this time, you can also spread the virus to other people. When you have the flu, you can have fever, body aches, especially in your back, arms and legs, chills, headache, cough, weakness, nasal congestion, and sore throat. In your usual common cold, these symptoms are very mild and not as severe and sudden as the flu. It is important to note that if you have dizziness, difficulty breathing, pressure in your chest area, and recurrence of the fever after getting better, then please go to the closest hospital to get medical treatment. The flu can be easily diagnosed with a simple lab test. A swab is taken from your nose or mouth and tested for the virus. This test is readily available at most hospitals. Most of the patients typically need bed rest and lots of fluids. In a few cases, your doctors may even prescribe antiviral medicines. While most people recover fully from the flu, but in some cases, it can cause serious lung infection called pneumonia. Children, the elderly, especially above 60 years of age, and pregnant women are particularly at a high risk of getting very sick with the flu.
Now that we know what the flu is all about, it is important to understand how we can prevent it altogether. Now, how do you prevent the flu? Some things you can do to prevent the spread of infection are: wash your hands with soap and water for at least 45 seconds, cover your mouth when you cough or sneeze, avoid crowded places as that is where the infection can spread more easily. However, one of the most effective ways to prevent the flu and serious complications is getting the flu vaccine. In fact, a recent mandate was passed by the Delhi government directing high-risk people, including healthcare workers, to get vaccinated with the flu vaccine. To know more about the flu vaccine, we spoke to Dr. Chadda from the National Institute of Virology in Pune.
The first and foremost, the high-risk group is the healthcare workers. These are those people who come in direct contact with the patients. Second are persons with comorbidities like diabetes, hypertension, obesity. Thirdly, pregnant women, especially those in the third trimester of pregnancy, they are supposed to get. And people who should not get vaccine are those who are basically allergic to eggs, because they may get an allergic reaction. Then there may be people who are immunocompromised, in children, asthmatics below 4 years of age. So these people should not get the vaccine.
Remember, the flu vaccine can take up to 2 to 3 weeks to become effective, so it is important to get it sooner than later.
In the US and other Western countries, it is also recommended that everyone above 6 months of age should get a flu vaccine every year.
It is very important to protect yourself from the flu. We urge all people to please go talk to your doctor about the flu vaccine as soon as possible.
See you next week on another segment of Doctors on Call. Till then, stay happy, stay well.